the other thing that I was thinking to ask you is more along the sides of radiology for kids. So what are your kind of rules that you're using over there? Is there any guidelines that you think are useful? Obviously, that's going to differ country to country. When you're taking your first Bitewings, are you taking OPGs or panoramics as a checking for development? Some places do, some places don't. What are your thoughts?
So I will say, I'll tell you kind of what we have. We have the American Academy of Pediatric Dentistry has guidelines, and they have a really good radiographs guideline that kind of shows you for a new patient, returning patient. For patients for Bitewings, for example, if their contacts are open, so if you have a 4-year-old with a lot of spacing, I can visualize the contacts. I'm not going to take Bitewings. But if the contacts are closed, if they're low risk, maybe every 2 years. If they're high risk, it may be yearly. And it just depends on the risk and kind of what I see at my clinical exam to determine what x-rays I may need.
And when you take your first Bitewings, that's always a interesting question because it seems to differ very, very significantly when you talk to different people.
I think it's based on, and I think it will just because it's based on what you see clinically and what you see with the contacts and of course the behavior, because I don't want to take Bitewings on a child who's not going to be successful because the diagnostic information that I get won't be good anyway. So it's kind of with kids, it's all those factors that you have to consider before you attempt to take the first
before I throw that little thing in there and they start crying.
I know. It's not easy.
In fact, on that note, what's your little tip for getting the Bitewings taken quickly, quietly, and efficiently without having the tantrum?
So what I try to do is kind of give kids enough information that they know kind of what they're going to feel and what they expect. So we talk about how breathing through their nose can help because that'll help settle the tongue and won't make them feel like they're going to gag or anything like that. We try distraction, like playing Simon Says or wiggling their fingers, things to get their mind off of it.
I'm breathing through my nose.
Just trying to give them some information you're going to feel. One of the assistants where I work says they're going to bite down on a little cookie. So she'll explain it that way. Just kind of using their imagination to help them cope with that experience. Of course, you'll always have some kids who you could do, all the distraction all day. It's still going to be a difficult Bitewing, but I find that helps.
Fair enough. And then to the panoramics, so I cut you off before.
No, that's okay. So for the panoramics, that I think is a very helpful x-ray for when you're in, mixed dentition, when you have the 6-year molars, the laterals, the centrals that are all permanent on the top and the bottom, to kind of see the positioning of the adult canines, make sure that they're, at an angle to come in, look for any, missing teeth, see if there's any development of the thirds. I think it can be very helpful. I think just timing of when you're going to take that picture will depend on a child's dental age and again cooperation.
So you're looking for those little landmarks, the first molars poking through, and you take those as a routine x-ray then?
I would say I take them frequently, I would say more often than not, just to see if there's anything oral pathology wise, look at the symmetry of the condyles, the shape of the mandible. It can give you a lot of, I think, good information.
Right, that's interesting because we don't tend to